Well, good afternoon, everyone. Thanks for joining us today in our continued discussion and focus on college towns, where we're reaching out from the Michigan Department of Labor and Economic Opportunity to discuss some of the unique challenges that college towns face as we move forward to contain COVID. Now, if you've been with me before, this will be similar to some of the discussions we've had about workplace safety and health, and we'll expand on that. Today, we have guest with us, Kevin Selmeyer, the fire marshal for the state of Michigan, to help with some of those capacity issues and other questions that we've been getting, as well as Barb Sebastian from the Liquor Control Commission for those bars and restaurant spaces to really focus in on some of those issues. College towns present very unique challenges. Now, we know businesses across Michigan have been fighting through COVID and trying to understand and follow the guidelines that are out there. And in college towns in particular, we have a quick inrush of people from around the state of Michigan and the country, and in some cases from across the world, that we have to try to navigate and deal with. I can tell you that we've been involved with discussions around the state of Michigan with colleges, including Central Michigan, and some of the things that they're doing to make sure they're ready for students. And they're doing very well with the things that they can control. What we want to talk about today with you are making sure that you recognize your role in the community and in helping the campuses and these students stay on campus by doing the things that you need to do to help us contain COVID. We have to absolutely fight this urge to become complacent as we're dealing with COVID. We know it's been a long time, but there's a long time to go, friends, and we're going to have to stick together to fight this out and make sure that we're continuing to drive those numbers down and keeping our economy open. Now, we also need your help because you're choosing to be with us today, and there's going to be a lot of businesses in your community that are going to affect your livelihood by the way that they open and act. And many of those are going to do things right, but they're going to need some help and some support. So make sure that you push this message down and out to everyone that you can in your community, whether that's individuals, other businesses. You can do that through associations, through your church, however you feel is necessary to make sure that everybody's engaging in this battle against COVID so that we can get open and stay open. And we all have a role to play to move things forward, and we have to look beyond what we have to do, which we'll talk about some of those things today, and also think about what we can do. What's the next step we can take to make sure that we're containing COVID and keeping our businesses open and thriving? We have to challenge all of us to push forward towards zero complaints, zero citations, zero transmission as much as we can. We know that COVID's going to be with us and we're going to have infections, but we have to work very, very hard to make sure we're keeping those as low as possible. And a lot of times as we work forward, we get this question about like finding the bad actors. And the important thing to remember there is that the term bad actor means that somebody has already committed a bad act. And in the face of COVID, that means we have possible community transmission. And we're going to be driving those numbers up in a way potentially that our local public health or our DHHS or the governor or county officials are going to have to make very tough decisions. And if we stick together and we fight through this, we can make it work so that we can get open and stay open. And don't forget the power of local action. We've seen in communities, East Lansing and Washtenaw County, local public health putting out heightened regulations on gathering sizes. The executive order allows outdoor gatherings of up to 100 people if you can maintain that social distance and you're wearing those face coverings. These local public health departments have pushed that down to 20 or 25, and they're very specific on where and how that would work. Don't forget about potential local ordinances if you need them in your community to perhaps bring landlords into the equation and other tools. We've heard of one community that has a known gathering point where they've hired security on their own to help disperse crowds. It's a sort of an open area that for some reason people just tend to congregate in. So they've hired security to kind of disperse crowds there. And today we're going to talk about some of those things as businesses that you absolutely need to do. And that includes creating a preparedness and response plan, conducting those daily health screenings of your employees as they're coming into the workplace, requiring all of your employees and customers to wear masks when they come in your establishment, following those limitations on size, making sure you're posting the signs and notices as required, closing those areas of your location that you need to, like your waiting area if you're a restaurant and having customers wait in cars, and then thinking beyond that to how you're going to control potential crowds of people coming to your location. That can be simple things like doing more reservations, using apps or other tools to have a better idea of how many people are coming and when. Also, as a Q&A, we're going to do about half of the presentation today as a presentation, and then we'll jump into a live Q&A where you can submit questions through the question and answer button at the bottom of your screen. So make sure you're entering those questions as we go along, and feel free to add them after we get to the question and answer period. I can tell you that from the Department of Labor and Economic Opportunity and across the state of Michigan, our goal truly is to get open and stay open in the face of COVID, and we're trying to fight through that with all of you. As you know, Michigan's had just over 94,000 confirmed cases of COVID. There's been about 203 in Isabella County. In the age groups that we're seeing, about 47% of those in the Central Michigan district is the 20 to 49 age group. We're really seeing increases start to pick up in that 20 to 29 age group, which is certainly that prime college age student age group. And we need to think through and work together on ways that we can help educate and mitigate those hazards. I would point out that Isabella County overall has been doing pretty well in the COVID crisis, but keep in mind that in August 5th-ish, Isabella County was ranked in that low category. By August 17th, they were medium to high risk with further outbreaks. So that's just to remind you of how quickly we can move through our stages of reopening and our possible community transmission from a low to a high spectrum just by having quick outbreaks in the community. COVID spreads very, very fast, and it just takes a few missteps for it to really have a big impact on our communities. And one of the things that you all know we need to be doing is wearing face coverings when we cannot maintain that social distancing. So while we have a 24/7 news cycle around COVID and we're hearing a lot of noise, there's a few things that have remained absolutely the same since the beginning. It's that need for social distancing, wearing those face coverings when we can't, and practicing good hygiene so that we're not picking up the virus and contaminating ourselves from surfaces. The virus spreads primarily through large respiratory droplets that we expel from ourselves when we talk, cough, sneeze, or sing, you name it, yell, shout, whatever. And that social distancing piece, that 6 feet or so, allows gravity to really take hold and get rid of some of those things. And outside with fresh air, we know that there's a larger dissipation that occurs, and that's why that's viewed as a more safe environment, where indoors air can tend to get a little bit stagnant and we have more of those issues, which is why that masking requirement is required indoors. And we have to keep in mind that with COVID, about 40% of the transmission or so is believed to come from people that are asymptomatic. Those are folks that will never get sick from COVID and likely never know they were carrying it. We also have a large percentage that are spreading this virus when they're pre-symptomatic, meaning they feel fine. So that's a lot of us out and about doing our whatever it is we do in our lives that either will never have symptoms or don't have any symptoms. And that's another reason these face coverings are so much more critical in keeping that social distance. And as you can see from this graph here, the chance of transmission of COVID between two people is at its practically none when we had the stay home, stay safe order, because we are practicing the ultimate social distancing and not interacting. And it's at its lowest when we are social distancing and wearing those face coverings. And we still remain low when we're both wearing face coverings. Some of the science is telling us that the face coverings may cut transmission by as much as 70%, which is why it's so critical that you're really doing that yourselves and reinforcing that for people coming into your place of business. To reopen and operate safely, it's just absolutely critical that you follow the executive orders, make a good faith effort to adhere to those guidelines, and train employees on health and safety practices. As I discussed how this virus spreads, as you think through the executive order and those workplace rules that you have to follow, they're really built around those concepts of preventing transmission either by social distancing altogether or wearing those face coverings and practicing good hygiene so we don't pick it up from surfaces. And we have great resources available at Michigan.gov/COVIDWorkplaceSafety, which I'll touch more on in a minute. And you should certainly check out the phased approach to re-engagement at Michigan.gov/MISafeStart. We really talk about 8 key steps that you can use with administrative controls. Engineering controls, you'll hear that term a lot from us, are those things that tend to be more permanent. So that would be ventilation changes, plastic barriers that are physically attached, and other tools like that that don't rely on human behavior to make sure they're followed. Administrative controls are things that you can do as management or owners within your workplace, but also rely on some form of human behavior to follow those controls. And among those are those access controls. Now, one of the executive order requirements is that you conduct a daily health screening for your employees to identify potential COVID cases. That's the ultimate tool in workplace safety, is to eliminate that hazard. And that health screening's goal is to eliminate that potential hazard from the workplace and help ensure that you don't have spread within the workplace. For bars, restaurants, and retail that have the public coming in, you also want to think about how you're going to have access controls for those folks coming in. Now, we know it's more limited, that people can generally just walk in and out, but that's one of the reasons you need to post those signs on don't come in if you're sick, wear your face covering, and other things, as well as, like I mentioned before, think through about some of those things about how you might disperse crowds if you're one of those types of locations where people wait for your service outdoors, or if you can have times when people can come in and out depending on what it is you do. And that's social distancing, making sure that tables or equipment or whatever it is in your workplace or your place of business are maintaining that 6 feet of social distance. You need to be thinking about sanitation protocols within your workplace. That's in regular daily cleaning perhaps after customers use a table or they leave the establishment, as well as what you'll do at the end of the shift and if you have an outbreak of COVID in your workplace. You want to think through the hygiene protocols. A lot of places, and maybe some of yours, have hand sanitizer right at the door. Employees have regular access to hand sanitizer and washing stations, and you're going to need to implement those controls to make sure that employees at least are engaging in regular hygiene practices. Making sure you're providing those cloth face coverings and other PPE that employees may need in the workplace to ensure that they're following the guidelines, as well as providing a safe workplace. And then really understand what you're going to do if you have a positive case. That includes notifying public health and potentially other workers that were exposed to that person in close contact, which we'll get into. And then ultimately, if you will need to have a facility closure if you have that positive case, and how you're going to manage that. We have a quick video on bars and restaurants that we'd like to show. This is one of the many tools we have available at Michigan.gov/COVID-Workplace-Safety. There are other videos there, but this one really highlights those things that you need to do in the bar and restaurant space for sure to make sure that you're providing a safe workplace for your employees and your customers.
For food service employees and their employers, there are new ways to work safely to help reduce the spread of COVID-19. Designate one or more worksite supervisors to implement, monitor, and report on the COVID-19 preparedness and response plan. Develop daily entry screening protocol for employees and contractors. Display a door or sidewalk sign with the services available, instructions for pickup, and hours of operation. Reserve parking spaces near the front door for curbside pickup only. Limit capacity to 50% of normal seating. Require 6 feet of separation between parties or groups at different tables or bar tops. Close waiting areas and ask customers to wait in cars for a call when their table is ready. Create or post communication materials for customers, including instructing customers to wear a face covering or mask until they are seated. Close self-serve food or drink options, such as buffets, salad bars, and drink stations. Require hosts and servers to wear face coverings. Food preparers should wear face coverings and gloves in the kitchen area when handling food. Install physical barriers such as sneeze guards and partitions at cash registers, bars, host stands, and other areas where maintaining physical distance of 6 feet is difficult. Limit number of employees in shared spaces. Provide physical guides such as tape on floors or sidewalks and signage on walls to ensure that customers remain at least 6 feet apart in any lines. And wherever you work, here are some guidelines and safety precautions for you to do your part in reducing the spread of COVID-19. Limit close contact with others by maintaining a distance of at least 6 feet when possible. Minimize handling of cash, credit cards, and mobile devices, and wash or sanitize your hands after handling. Practice routine cleaning and disinfection of frequently touched surfaces and tools. Wash your hands regularly with soap and water for at least 20 seconds. Avoid touching your eyes, nose, or mouth. And be sure to follow these safety precautions. Wear face coverings or masks. Check for symptoms that often include fever or abnormal cough or shortness of breath. Stay home if you are sick or have been in close contact with someone who is sick. Report your diagnostic test results and exposures to your employer, and participate honestly and urgently in workplace safety training. For additional resources, visit Michigan.gov/MIOSHA.
So that's a great video and a tool that you can use in your workplace, or if you just need to review it, there's a lot of other information I'll touch on in just a moment, but there are additional regulations too that you want to be aware of. There are more restrictive or specific guidelines depending on your industry or your region. As we all know, certain regions of Michigan are more open than others. Those are typically the 6 and 8, the Traverse City North and the UP regions. We have some higher restrictions in the region of Mount Pleasant and others that you'll want to pay attention to. And then we have some rules from other agencies, including the indoor service being restricted for bars that earn more than 70% of their gross receipts from alcohol sales, that you'll want to make sure that you're following and paying attention to. And I'm going to turn it over now to our friend Kevin Selmeyer, who's the fire marshal for the state of Michigan, to talk about some of the things that they're working through.
Hey, thanks, Sean. Thanks for the opportunity, the Mount Pleasant area, to share some information with you today. One of the things that I want to share with you is that the fire marshal's office is within the Bureau of Fire Services, and which is within Lara, and my name is Kevin Selmeyer. One of the things that we want to talk about is college and university classrooms and dorms all fall under the Bureau of Fire Services in the State Fire Marshal's Office. Recently, Executive Order 159 was issued, which allows colleges and universities to use spaces that haven't been pre-approved as classrooms so that social distancing can be accomplished. And if there's any questions on that, it's a matter of, I'll give you my number later on, you can reach out to me. But the idea here is to allow other buildings and venues and sites to be available on the campus so that we can disperse the students. Also, a question that came up yesterday, I think it's important that we talk about, if you have students that are in the dormitories, you do need to do your fall fire drill. There are 3 fire drills required per year for college and universities. The first fire drill needs to occur within 21 days in each dorm of the course of classes beginning. And from what I understand, I know that Central Michigan University is already in class. So within 21 days, the fire drills have to occur. Some things that the resident assistants should be talking about with the folks who live in the dorms is social distancing. I know that that's one thing that the colleges that have already been talking about, but further to make sure that they understand that during the fire drills, we want to try to maintain as much as we can, which will require a larger disbursement area outside of the dormitory when you conduct the fire drill. And we can answer questions at the end of this program if you have further information or need further information about that. Other areas that the State Fire Marshal has jurisdiction in are places of assemblies, or public assemblies, excuse me, and restaurants and bars definitely fall within the public assemblies. We are always going to want to work with the local authorities that are in the area. Because many times our closest fire inspector may be up to an hour away from where we have to respond to these events that potentially are happening. Movie theaters, concert venues, and clubs are currently closed at this time, but those are defined as public assemblage. Sean, can I go to the next slide? So how can we help the local fire department, or how can we help even the local authorities, the communities, the townships? Fire departments, we have the ability to help you to establish what the capacity issues for these venues should be set at. One of the things that was shown in the video that we just showed you is that many times capacity is kind of hard to calculate. We've been asked this question many times when we've done these programs. depending on the size of the physical size of the bar within the bar restaurant, takes up a large space. That's going to have an impact on capacity, but also the size of the tables. Because we're trying to get 6 feet between parties, it's kind of hard to just, if you want to say off the cuff, say this is the number based on the square footage. So that's one of the things where the local fire department can help you with. If they can't help you, by all means, reach out to the state fire marshal's office. We can help you with that. One of the things that it does allow for us within statute is that we have the ability, if a business is over capacity, in the past this has been overcrowding for normal fire capacity, but with the executive orders, we can assist in temporarily keeping people from entering. Also, it may be that we temporarily close a venue, let's say for the balance of the evening. And Barb will be on later to talk about how liquor control gets involved in this. But it truly is the Bureau of Fire Services working with the local authorities, police and fire departments, so that we can provide social distancing and make things as safe as we can. So one of the things that I wanted to share with you on this slide here, this is my cell phone number. If you have any questions, you feel you need to reach out to the state fire marshal, by all means, please call this number. And it's Sean, I want to thank you for the opportunity to be here today. And one of the things that all the state agencies, we have a common theme. We want to educate, and that's what we're trying to do here today. And it's built around relationships. Today's phone call is to develop those relationships. State Fire Marshal's office is ready to work with the local authorities in your area. Thank you.
Thanks, Kevin. Now I'll turn it over to Barb with the Liquor Control Commission.
Wasn't unmuted. Good afternoon, and thank you for having me here today. Very happy to be part of this presentation. The Liquor Control Commission is very engaged in working with licensees to get them open and help them stay open. As many of the licensees know, we enforce the liquor laws and rules in Michigan. We've also been enforcing executive orders since those have been created this year. We do check businesses and make sure that they're in compliance with laws, rules, and executive orders. Our folks are working out in the field right now, and they have been during the COVID crisis, safely, of course, using required protocols. We do provide education to licensees so that they know what their responsibilities are and what's expected of them. We also work with local police and local authorities to partner with them to make sure that businesses are compliant and that everybody knows what they're supposed to do. We do provide funding to local police as well so that they can assist us in those duties and have money for their own operations. If bar owners and licensees need information from the Liquor Control Commission, our website address is listed here. We have lots of resources for you. There's COVID information. We have reopening resources, which not only include what some of the restrictions are currently, but also information about new permits that we've created during this time to help you expand your area, a lot of it on the outside. There's some great options for you to assist in your business. Please feel free to use our website for those resources. If you need to contact someone from Liquor Control, I provided my email address. Be happy to help you out and answer questions for you. Mount Pleasant area is part of our district, and so feel free to contact me if you need something. And again, I wanted to stress, like Kevin said, right now our goal strongly is to educate and help businesses succeed. We are taking action when we have to. If we find businesses that are ignoring the executive orders or that are creating unsafe environments, we may have to take action. But we wanted to make sure that all of you understand that, unfortunately, the bar scene pretty much is an area where there's been a lot of new cases of COVID. Human behavior drives this. As Sean has been talking about, basically in bars, a lot of times there's loud music, people are talking closely together, they're crowding, they're dancing, they're consuming alcohol, which will lower inhibitions and affect good judgment. They're trying to scream over the music. Those things facilitate the spread of COVID. As most of you should know by now, it's not allowed for you to have dancing or any topless activity during the COVID situation right now. That may change, but currently you can't allow that. So you need to prohibit your customers from doing that, or your employees. You are required to have your employees and your customers wearing masks. You are allowed to ask customers to remove their mask for the purpose of identification. We encourage you to do that if you're not sure if someone is of legal age to be consuming or purchasing alcohol. Also, you can ask them to remove the mask so that you can determine if they're intoxicated. That's another important reason. You have that authority. Please use it. We do want to make sure that the number of kids in the 20 to 29 age group that are getting COVID reduces. So that's why we're here to help educate and help you find ways that you can protect your customers, your employees, and the public. I did want to mention quickly, we get a lot of questions about the 70% requirement. A lot of bars and restaurants have asked us about that. Basically, we're going with the common definition of gross receipts, so that if 70% or more of your gross receipts are from the sale of alcohol, you're restricted from having indoor dining at this point in time. You may want to check with your CPA or bookkeeper to make sure that you are in compliance to be open for indoor service. But basically, that's the way we're rolling. We are checking some businesses about that as well. We may have to ask for business records. But our goal, like Kevin said, is educate first, take action if we have to. Thank you so much.
Thanks, Barb. And as I mentioned, we have a ton of other great resources available. We've been building this since the beginning of the COVID crisis, and we continue to build it. So I'd encourage you to check back often at Michigan.gov/COVID-Workplace-Safety. We have industry-specific guidelines created by MIOSHA there for every industry that's been named in an executive order, and that certainly includes bars, restaurants, and retail. Those will be in compliance with the executive orders as well as the CDC guidelines for those types of industries. If you're not named in one of those guidelines or not named in an executive order, then you would follow the general industry guidelines, which would be applicable to everyone. And we have great tools there, including reopening checklists, fact sheets that you can use that really highlight some of those things, more videos like you saw. We have social media tools you can use. We have posters and other information there, and we have those in alternative language as well. Here are some examples of the posters that you can download and print from that site. That includes that no mask, no entry poster that's required to be posted. There are a few variations of this, and there are certainly industry-specific posters as well, like the one there about the waiting area being closed. Please wait in your car, and other things that you're going to be doing to try to maximize the safety in your business establishment. You can always find more information at the Central Michigan District Health Department. They have great information about coronavirus and things that they may be doing, as well as Isabella County on the preparedness and response to COVID. Again, that website I just mentioned, we have a great link on our website to the Michigan Economic Development Corporation. They have a Peer Michigan Business Connect platform that you can go to find PPE and those other things that you need, including hand sanitizer, physical barriers, and face coverings. If you are making those things, a lot of distilleries moved over to making sanitizer. You can connect your business through that platform as well to sell to other businesses in Michigan. For the daily health screening protocol you're required to use, I encourage everybody to check out the My Symptoms app that was created by our Michigan Department of Health and Human Services in coordination with the University of Michigan. And it provides a smartphone use daily health screening protocol that will ask the health screening questions that are required. And you can do that by going to the app as an employer, and you set up an employer account. You'll be able to designate where those reports go and who they go to. There can be multiples from what I understand, and you'll get an employer specific identification code. You then give that code to your employees. They set up the app on their smartphone, their tablet, their desktop, or whatever they want. And before they come in every day, they can complete that questionnaire. They'll get a green if they're not showing any symptoms of COVID. They'll get an orange if they are. That will also instruct them to contact you as well as their healthcare provider. And certainly always check out the Michigan Safe Start site for the phases of reopening and other information there. And there are great tools at Michigan.gov/maskup for that Mask Up Michigan program that we've talked about being so critical to make sure that we help contain the spread of COVID. Our folks over at MIOSHA have created a great hotline for employers and employees with questions related to COVID in the workplace. The average wait time here is about 15 seconds, and you'll get connected directly to somebody within MIOSHA, and you can reach them at 855-SAFE-C19. Any question you have about what you could or should be doing in your workplace, either as an employer or an employee, you can call in there. If you're an employer and it's necessary, they can get you over to their consultation team. They have a wonderful consultation team that's available that can do phone or in some cases on-site work with you to make sure that you're putting the appropriate things in place and doing everything that you can. And for employees, if it's necessary, they can get them over to the complaint section of the MIOSHA process for employers that may not be abiding by these regulations. So it's a great tool. Make sure you take advantage of it. There's no question too small, so feel free to make sure that you call in and check that out. And for now, we'll switch over to the question and answer of our program.
All right, thanks for all that information, Sean. Hello, everyone. My name is Erica, and I'm going to be assisting with the Q&A portion of this webinar. I see we have a few in the queue already, and for anyone else attending who has a question that they would like Sean, Kevin, or Barb to answer, go ahead and use the Q&A tab to submit your question now, and we'll get to as many as we can. So with that, I will go ahead and read off the first question that asks, can we tell an employee where to go for COVID testing? We know some places get results sooner and would like to have staff get back to the office quicker when testing.
Sure. If you're an employer that's implemented some type of testing protocol, obviously, the employer could designate certain sites. If it's just a general, like, hey, go get a test, then and you're putting it on the employee to try to find that, then obviously it's going to be much more difficult. But if employers are using some type of testing protocol, and there's only certain employers right now that have to do that, those include agriculture and medical facilities have some certain testing protocols. For others, I would encourage you to check out the CDC guidelines on the testing protocols because they've changed some of the parameters to focus more in on time and symptoms.
All right, and the next question is, what measures are being taken at CMU to social distance the students who live on campus? And what about in classes?
So I don't want to speak directly for CMU, but I will share some of the information that we've garnered from our continued discussions with colleges all over the state, CMU being one of them that's put together some great plans to make sure that they're dispersing the number of students in classrooms, and they've found a few different mechanisms to do that. I believe they have some student ambassadors or other leaders, student leaders that are helping with some of that dispersion, and then certainly all of the employees on campus are engaged in making sure that they're helping avoid congregation. As I mentioned with why we're doing masks and hygiene and those things that have remained static, as you can see from the video and everything we've discussed with Kevin and Barb so far, it's really about those three primary tools, that social distance, masking, and hygiene. And CMU is working to make sure they're implementing that across the campus as well.
All right, and if we have an employee who tests positive, do we have to notify other employees or will the county notify them?
Employers have to do contact tracing for their employees in the workplace. So they would need to determine like what area of the building that person worked in, what other employees were around them, and then notify those particular employees. And when you are considering that, one of the pieces is, did they have close contact? Close contact is defined as within 6 feet of each other for 15 minutes or more. So they definitely want to contact that group of employees.
All right, and what is CMU doing to hold students accountable for their off-campus behavior that is not consistent with health and safety for the entire community?
So again, I don't want to speak for CMU, but most colleges across Michigan have implemented student codes of conduct. They've already had those, and they've expanded those conduct rules to include other behaviors, and many have included off-campus behaviors.
All right, and is isolation required while awaiting a test result?
Potentially. If you're testing as part of a regular protocol, then perhaps not. But if you're testing because you have symptoms, then you absolutely should be isolating until you get the results of that test.
All right. And how soon after a negative test can someone return to class or work?
So the CDC has changed their guidance on the testing protocol. If you have symptoms, it's going to be a time-based protocol. So you're going to need 10 days, and your fever, if you have one, has been reduced for at least 24 hours without medication, and your symptoms have lessened without medication. If you continue to have a fever and symptoms after 10 days, you're going to need to continue that isolation.
All right. And if someone attends a large gathering, do they need to quarantine before returning to work?
If someone, what I would encourage you is don't attend a large gathering, right? So one of the things that we talk about is that this is a community issue. It's a public health crisis that impacts workplace safety. So it's not as though those establishments we talked about themselves have issues. It's that we as humans are there and congregating. Those congregation, as we've seen in the news, whether it's a wedding reception or some party somewhere, that congregating is where those asymptomatic and pre-symptomatic folks are really spreading that virus around. So I would encourage you, first and foremost, don't attend a large gathering. Secondly, I would make sure that your employer is aware that you were at a large gathering, because if it's appropriate, depending on where you are and what you're doing, they may need to keep you out of the workplace until you have some time to see if you've contracted COVID, to protect your other employees as well as that establishment.
All right, I have another one here. Do my best here. I'm not sure exactly what they're asking, but maybe you will. If someone is requesting patron removal of a mask, is additional PPE recommended or required, for example, a face shield?
So in certain workplaces, and face shields are recommended if you cannot consistently maintain 6 feet of separation. So for that, probably that issue that Barb brought up, if I'm asking someone to lower their mask to verify their age, certainly that employee would want to maintain that 6 feet of social distance. If it's in a retail setting, we would highly, highly encourage that they also have those plastic barriers in front of those retail clerks to make sure that that's not happening. But keep in mind that close contact is within 6 feet for 15 minutes or more. If you are asking them to lower their mask, I would encourage you to just kind of back up. Additional PPE may, like a face shield, may be appropriate if it's going to be a long time, but it just, from that type of situation, it seems like it would be quite brief. And if you can maintain that 6 feet, you should be okay.
All right, well, those are all the questions we received so far. Is there anything you wanted to add, Sean, before we close out?
Absolutely. Once again, Kevin and Barb got off easy in our question and answer period, but I think they shared a lot of great information. Before I wrap up, is there anything, Kevin or Barb, you'd like to add?
Sean, I
No,
think
I can't think of anything.
Okay.
Other than
Thanks, same here.
to work with the local authorities so that we can get solutions that work, as you shared, so that we can prevent the spread and keep Michigan open.
Yeah. Okay. Thanks, Kevin. So we appreciate the questions that we received. We appreciate you taking the time to be with us. Again, I'd ask you to make sure you push this information out. Make sure folks understand whether you're in the workplace or just talking to your friends in the community, that congregation, social distancing, masks, and hygiene. We got to avoid the congregation. We got to wear those masks. We need to practice good hygiene and maintain that social distance, because we all have a role to play to make sure that we can get open and stay open. We want to keep moving our economy forward in the face of COVID, and to do that, we have to keep driving our numbers down. And that means we have to be doing those things. And as business owners, as students, as colleges, we all have to take ownership of this virus and make sure that we can control ourselves. We can control what we do and make sure that we're containing COVID, because while it might seem like, things are good in Isabella or things are good in the north, it doesn't take long, as I mentioned, from August in a 10-day period, about a 12-day period, Isabella moved from like low risk to a medium high just that quick. And if we have large gatherings, as people come back, whether that's in a bar or a restaurant, or it's, some congregation point that we know people hang out at, it's going to be very quickly spread in our communities. And that puts lives at risk, it puts businesses at risk, it puts our economy at risk. So we really have to keep pushing this information out and making sure that we're doing what we can. the time it takes to participate in a webinar like this is not that critical, and it's good that you're here to make sure that you're seeing those things. And we are available for questions. Make sure you're using that hotline if you have questions about your workplace. Those videos really break it down to a snapshot on certain types of industries, and they're very valuable to the work that you're trying to do. Keep thinking beyond what you have to do and thinking about what you can do to make sure you're supporting your community, to keep that college open, to keep your business open, and to keep our community safe. We think we can keep moving this ball forward, but we all have to take a little piece of this challenge and make sure that we are carrying the ball forward with everyone else. And we'll continue to engage with community leaders in the colleges to find and identify things that they're seeing. Make sure you're working with your local municipal and public health leaders if there are things that you need in addition to what's happening with the executive orders, and make sure that we're all getting open and staying open in the face of COVID. And I appreciate what you do, and make sure that we keep driving forward.